morning, everyone. Our guest of honor in absentia, senior members of the ENT Society, junior members including ENT students, ENT Clinical officers present, invited guests, ladies and gentlemen. I am Onesmas, President of the Association of all ENT Clinical Officers of Uganda. I have not come alone. I have come with other clinical officers, and I request ENT clinical officers around to stand and wave to the group. Thank you. I bring to you greetings from ENT clinical officers that are serving across all regions of this great nation. I also bring to you greetings from the CMS, that is the Chieftains of Medical Services, UPDF, from where I offer ENT services. First and foremost, I take this opportunity to thank the organizing committee and the leadership of the Society of Otolaryngologists of Uganda for granting us an opportunity to be with you at this annual conference 2023. We look forward to formally joining you officially and becoming members legally. Secondly, allow me to introduce the topic of today, which most of you are familiar with, the ENT Clinical Officer of Uganda. An ENT Clinical Officer is a medical professional trained, qualified, and registered to manage and treat conditions and all arising from the nose, ear, throat, head, and neck regions. He must have undergone a 2-year post-basic diploma training to acquire a higher diploma in ENT, stroke, head and neck surgery. This means that he or she acquired a 3-year basic diploma in either clinical medicine or nursing, and with an experience of not less than 2 years in clinical practice. This means that on average, an ENT clinical officer has 7 years experience in the medical field. Duties of an ENT clinical officer in Uganda. Obvious roles of an ENT clinical officer in Uganda include, but not limited to, the following. History taking, conducting hearing, screening and examinations, offering treatment of ENT conditions, referring of patients to other specialties, including SLGs, audiologists, ENT surgeons, and any other. Recommendation of rehabilitation and assistive products or services. Performing minimally invasive surgeries and procedures, research, education and mentorship, management of ENT clinics, plus promoting awareness of ENT services. In reference to the above, available and proven data shows that from 2001, when the first intake of a higher diploma in ENT, stroke, head and neck surgery was enrolled at the UHAMS, then Mulago Paramedical School, over 96 ENT clinical officers have been trained and qualified. These are distributed in the different regions of the country, and the majority of them are involved in active clinical service. Unfortunately, a few are registered with the Allied Health Professionals Council for reasons I will discuss below. These clinical officers have held the flag of ENT services higher, especially in areas where there is no any other ENT cadres like audiologists or surgeons. Point in reference is, ENT clinical officers have demonstrated competence and courage in efficiently running ENT clinics at several sites, including Naguru Hospital, Fort Portal Regional Referral Hospital, Masindi Hospital, Kawolo Hospital, General Military Hospital in Bombo. Here we are assisted by an ENT surgeon, Dr. Nakasaga Esther, Mukono Hospital, and others. Others offer ENT services at private basis, something that has brought ENT services closer to the masses. An example is Global Medical Center, which has specialized in ENT services in Bombo community. Challenges faced by ENT clinical officers. Just like any other health professionals in Africa, ENT clinical officers face several challenges, among which include the following: poor oral pay as compared to other counterparts with equal years of training, experience, and work input; lack of formal recognition in government schemes of service and formal structures; lack of promotion opportunities wherever they work from; poor facilitation and lack of equipment in a majority of the ENT clinics across the country where these ENT clinical officers are placed; expensive ENT equipment on open market for those in private practice to an extent that some of the equipment must be imported at very high prices; high taxation and unjust